Hi, does your child talk when he's alone, but when you ask to child or you try to interact with the child doesn't like to talk with you? Hi, Namaste. I'm Kamal Sharma, speech language pathologist. Today we are going to talk about the apraxia of speech. Sometimes people call it a praxis also. So the apraxia of speech is a problem which a child has a conditions of programming and planning. The child cannot program and plan what to say, when to say, etc. Though their executions are good, they can say something when they want, but when you ask something, they cannot say it. And the study says that 60% of the children with autism spectrum disorder has a apraxia of speech. You may be wondering that my child keep playing and then keep making some sorts of sounds, but when we try to make the child to talk, he's not talking, he's not repeating. Even though after giving therapy there is no much progress. So it's a good time to identify if the child has a apraxia of speech or not. For that, you need to consult a speech language pathologist and identify whether the child has a apraxia or praxis symptoms. You can see few of the features that can be like the child will be talking alone, the child will be communicating when something is very important or he want the favorite things to be get or given, then the child will use a word. Or you may think or you may see like the child will make a word, or he will try to make a word, like he will try to search the word across the mouth. Sometimes the child also may try to talk in a sentence when he want, but when you ask, when you instruct the child to do something, he might not follow. There are three types of apraxia. So one is verbal apraxia, where the child has a difficulty in talking upon your instruction. There is oral apraxia. When you ask your child to move out the tongue, he cannot do it. If you ask the child to lateralize the tongue, he cannot do it. You ask the child to elevate the tongue, he cannot do it. When you ask the child to smack the lip, like, cannot do it. When you ask the child to smack the tongue, they cannot do the tongue click, right? These are some of the oral apraxia. And there are limb apraxia as well. If you ask the child to raise the hand, he cannot raise it. But when you will see he's playing, he can do everything by himself. So these are some of the features which can be together, can be alone in autism spectrum disorder or in some other conditions also. Please consult a registered speech language pathologist and get verified if your child has apraxia of speech or not. If you like to see such video again, please do subscribe my channel and like and share among your colleagues. Thank you so much. See you again.